Okay, so you're going to be the MC, right?
Yes.
Okay.
All right. I will get us started. So good evening, everyone. Thank you for joining us. Tonight, we are going to be chatting about the surrogacy process, both from the agency perspective and also from the fertility clinic perspective. And Dr. Lavy, do you want to introduce yourself?
Sure, absolutely. So good evening. Happy Tuesday. Good to have you with us. Yes, as Casey said, I mean, it's a sort of a pleasure to have Casey co-host this webinar. And the idea was to try and explain the process of surrogacy and how it works from the agency perspective and the clinic perspective. So I'm the clinic, and I'm going to tell you a little bit more about the medical process of the surrogacy. See, I just want to, So I'm the director and the founder of the New England Fertility Institute. We're located in Connecticut, in Stamford. And my background is in OBGYN and in reproductive endocrinology. I've been in this field for many years, almost 30 years now. And it's been amazing for me to watch how the field has evolved, and basically what that means is that it allows more people to have children. We have higher success. We're able to have children for heterosexual couples, same-sex couples, single men, single women. So that's sort of the idea, and we're going to show you sort of at least one aspect of it, which is the surrogacy aspect.
And so I guess I jumped right over my intro, but I am Casey DiPaola, and I'm one of the co-founders and director of Intended Parent Services at New York Surrogacy Center. I'm also an attorney licensed in multiple different states. And I'm here today to talk about the perspective of the surrogacy agency, New York Surrogacy Center, which is a surrogacy program that's licensed in New York State by the New York State Department of Health. And we work with intended parents all across the country, but really kind of focused in the tri-state area, New York, New Jersey, and Connecticut. And we work with surrogates primarily on the East Coast with a focus on surrogates in New York State specifically. So I think you want to advance the slide, please. So as I was mentioning about New York Surrogacy Center, I said some of this already. Some other things to just mention quickly before we talk about the process is that basically what we do as a surrogacy agency is that we recruit women to act as gestational surrogates. And I should probably define that at the beginning. So what we're talking about is a woman who's going to come forward to carry a pregnancy for someone, for an embryo, from an embryo that she's not genetically related to. So this would be the intended parent's embryo, whether created from their gametes or donated egg, sperm, or embryos. But she is not genetically related to the fetus that she's carrying. And so we recruit women to act in that capacity. And we pre-screen them, and then we match them with intended parents. And we are really a full service matching agency. So we do everything throughout the process to make everything as smooth as possible for our surrogates and for our intended parents. So we do everything from making travel arrangements to coordinating with the fertility clinic for medical screening and psychological screening, making medical appointments for the surrogates, checking in with them after appointments, updating the intended parents, coordinating with OB care and hospitals, all of those types of things. We also have an option that I always like to share, which is that if you are considering going the route of an independent journey where you don't have an agency involved, because you have your own surrogate, whether it's someone that you know or someone that you've met online. Our agency actually does a decent number of journeys where people will bring their own surrogate to the agency because they feel like they could still benefit from the support and the knowledge that the agency has in supporting the journey. And when we do that, when someone brings their own surrogate to the agency, we do discount the agency fee by 50%. And just, we are attorney owned and operated. So as I mentioned, I'm an attorney, and my partner, Joe Williams, who runs the surrogate side of our program, is also an attorney. And Joe and I run the agency in a very hands-on manner. We both do all of our initial consults with our clients, and we are involved all the way from day one until our clients take their babies home from the hospital at the very end of the process. If you could go to the next slide. Okay, so one of the big things, one of the really important things that your surrogacy agency is going to do for you is that they're going to pre-screen your surrogates. So that by the time you're matching with a surrogate, you know that she's really been vetted and is an appropriate candidate to move forward. So our process starts with an intake call that happens with Joe, who's our director of surrogate services. And those calls are fairly lengthy, and he really does a lot of education for the surrogates during that initial call to make sure that they understand all of the components of a surrogacy journey. You know, the time commitment, the medical appointments, the shots that are involved, the legal process, the travel, all of that. And assuming that that call goes well and the woman is sounds like an appropriate candidate, he will send her an application to fill out. And we're gathering a lot of medical and social history in that application. And assuming that all looks good, we then move on to the pre-screening process, which is going to be background checks for the surrogate and spouse or significant other. And those are pretty comprehensive. It's going to turn things up like criminal history, civil lawsuits and judgments, which are going to include things like foreclosures, evictions, small claims, those types of things. We also check to see if the surrogate has any child abuse or neglect history. We also do drug testing on our surrogates. We also do STD testing. We have them meet with their OB to do an updated pap smear, and also just talk to their OB generally about, you know, their own medical history and whether they would be an appropriate candidate to be a surrogate based on that medical history. And if their doctor thinks that they are, we'll have them fill out a recommendation letter for them. We also obtain all of their medical records from their prior pregnancies and deliveries and have those reviewed and summarized by comparing them to the American Society for Reproductive Medicine guidelines for gestational surrogates. We also have our surrogates' medical insurance reviewed. Not having surrogacy-friendly insurance is not something that's going to disqualify a surrogate, but it does change the overall cost of the journey. So we make sure to obtain her policy and have that reviewed before you are considering a match with her. For the same reason, we also do income verification so that you're going to know what lost wages are going to look like for your surrogate when it comes to that point. And then we wrap the process up with a virtual home visit that Joe conducts. And he gets, you know, a virtual tour of the home so we can see what the living situation looks like. And he also makes sure to meet the other members of the household. And then that's the final check-in to make sure that she's really in a place in her life where she's ready to commit to this process and that her support system is in place and she's ready to jump into the matching process. Next slide, please. And that takes us into the matching process, which is, you know, the next big thing that your agency is going to do for you. And so when we are looking to match surrogates with intended parents, we are considering the intended parent preferences, which can range from things like the surrogate's age, her location, whether she has surrogacy-friendly insurance, whether she's married or a single mom, things of that nature. We're also taking into consideration your clinic requirements and also your surrogate's preferences. So she may also say, you know, that she wants to work with a married couple, a straight couple, a gay couple, a couple using a certain fertility clinic or located in a certain geographic area. So we're trying to make sure that all of those things mesh when we're looking for matches. Once we think we have a surrogate that might be a good fit for particular intended parents, we will show the intended parents her profile, which typically has a picture of her and has information about pregnancy history, medical history, social history, vaccination status, and, you know, a little bit about her and what brought her to surrogacy. Assuming that the intended parents are interested after reviewing that profile, we will also share a redacted application and pre-screening materials so that they can really get a feel for who this woman is and see if they feel like it would be worthwhile to move on to the next step. If so, we then show the surrogates the intended parents profile, which also has some information about them, the clinic that they're working with, their embryos that they've created, and about them as people and what brought them to surrogacy. Assuming the surrogate also feels that it's a good match, we then send all of the medical records to the intended parents clinic to review and make sure that there aren't any red flags from the clinic's perspective about this particular candidate. That review can take anywhere from a few days to a few weeks, just depending on, the doctor's schedule, how voluminous the records are, things of that nature. And then assuming we get the green light from the clinic, the next step is that we set up a match meeting, which we host over Zoom. And the match meeting is going to cover, the important topics about surrogacy to make sure that the surrogate and intended parents are on the same page about those types of things. But it's also just a chance to get to know each other and really make sure that there's a good connection there and that you feel comfortable with each other. After that meeting, we check in with both sides, and if everybody felt that it went well, that's when we would make the match official. And then that's when the clinic really steps in and takes over to go through the medical screening process. Oh, I believe you're still muted.
All right, better?
Yep, there you go.
Yeah. So a few words about the clinic. I already mentioned we're in Stamford in Connecticut. I've been in practice for many years, and in the last, I'd say 5 to 10 years, I decided to basically focus the practice on egg donation and surrogacy. So what we call third-party reproduction. It's just something I always was interested in, I was passionate about, and it's a little bit more complex than basically the standard fertility treatments. And I always felt that, to do it well, it's important to be more focused and create the infrastructure to support the process, the parents, and so forth. So at this point, we only do surrogacy and egg donation. We're sort of a little bit unique as far as that goes. And that allows us to basically, I think, do the process a little bit better. For example, we for each individual or couple that goes through, we have we call them coordinators, somebody who's a caseworker who is attached to you through the process and helps you with all the different arrangements and just for general support. And I always am available for any question, any concerns. You always have my email, my cell phone, so I'm always available and very hands-on in the process. And one thing that I've always felt when I left the university and started my practice is that, it's very sort of, we have to find the sweet spot between offering the state-of-the-art technology and just also keeping at the same time, keeping it very personal. Because everyone comes into these processes, especially with surrogacy, from a different place. So, for example, heterosexual couples are very different than same-sex couples, just because, heterosexual couples usually come to surrogacy after they've tried their own most of the time. And for same-sex male couples, it's really the only way they can have children. So everyone has different needs and comes from a different place and needs a different type of support. So I always try to design the treatment based on the person, the couple's background, history, and of course, connect them with the right technology, with the right medical technology. And as I said earlier, our field, which is still a young field, has come a really long way in the sense that, we have more options available. And I'd say that if you are willing to take advantage of everything that's out there, you're just about guaranteed to have a baby. So if it's hopefully your eggs, and if not, it's a donor egg, and if it's your uterus or not, or if it's not, it's a surrogate. Same with the sperm. So if you're willing to do what's necessary, because as I said, it's almost guaranteed that you can have a baby. For surrogacy, and when we do surrogacy, of course, we work with surrogacy agencies, and I want to emphasize how important it is to find a good agency. And those of you who have sort of been there doing their due diligence realize that there's many surrogacy agencies. I think last count was over 400. So for someone who's not really in the field, it's very difficult to know how to choose their agency. And again, because we only do surrogacy and egg donation, we always work with agencies. And I've sort of, for myself, I've sort of picked a handful of agencies that I know and I trust, and I have good experience with. And definitely Casey and her agencies are sort of on the top of our list. And I want to just again say that it's really important that the clinic and the agency know each other's processes, are familiar, and know how the other party works. Because there's a lot of back and forth between the agency and the clinic, and having this knowledge makes for a very smooth process. So as Casey said, I mean, you always start with them, with the agency, and they will help you find a match, a candidate. And the long list of that Casey presented, as far as what they do, and the virtual home visits, and the background check, and insurance, and all of that, of course, comes first. And then they also have our medical criteria, medical requirements. And the medical requirements, I mean, it's pretty straightforward. I mean, of course, we're looking for someone who is physically and mentally healthy. And we're looking for someone who we think can carry a baby with minimum risk of complication. So the best way to do that is to take basically only women who have children. Because having a pregnancy, a delivery, it gives us a lot of information about them, and allows us really to predict how they'll do when they're pregnant with your baby. So I would say that having children is probably the only really important criteria for surrogacy. Because then we can look at their records, and we can look at any complications and what type of delivery, was there a natural birth or a C-section. We also check to see which hospital they delivered. Obviously, we want to make sure the hospital is good and that there is some access to a high-risk pregnancy specialist, just in case there's a problem. And as Casey mentioned, actually including the surrogate's OBGYN in the decision-making about her being qualified, I think is really key, because this is the person who delivered her children in most cases. So they're very familiar with her history, and it's someone who will take her back when she's pregnant. So their blessing, their approval is very important. And we take their their comments very seriously. So again, in order to qualify, she also needs to get the approval, the blessing of her OBGYN. Now, the other criteria, such as age, for example, I put here 30 to 40, just because this is, I'd say, sort of the average, pretty wide range. Mostly has to do with the fact that these women are women who have completed their families. They're not looking to have any more children. But we have younger surrogates and older surrogates, and they have good pregnancy, they're healthy. And I like to look at the individuals and make a decision basically for each case based on their history. Let's see here. So the age, as I said, and the BMI is another criteria that we look at. We, of course, like the BMI to be normal. You know, as probably you all know, that it's becoming a little bit more difficult these days to find women who have a normal BMI. But we, again, use all those things as guidelines. But once we review the individual case, so if she's a little younger, a little older, if she's a little heavier, as long as they're healthy and they have a good pregnancy, we consider them to be good candidates. So again, I think the individual approach is key to making sure that you end up with a good surrogate, meaning that someone who will carry your baby with minimum risk, somebody who is basically well-adjusted, who understands the implications of being a surrogate, you know, what it means for them, what it means for their family, their partner, their children. So all of that, actually, we try to assess with their through their medical records, and then through their in-office screening. So after that long list that Casey shared with you of what they do, they basically do a match and send us the medical records. So we review the records and make sure everything checks out. And then if everything looks good, we invite them to the office to do the medical and also the psychological screening. I would say that, you know, most of the surrogates that we work with are not local. Local meaning they're not within driving distance. And one of the things that we try really, really hard is to make the experience for the surrogates a good experience. And for most part, that means that we try to make it easy for them and keep them close to home for as long as possible. So for the typical case, the surrogate will come to us to do her medical screening, psychological screening, and then come back to do her embryo transfer. So the first visit is for the screening, where we do a medical evaluation of uterus, structure, function, blood work, and also do the psychological evaluation. And that involves meeting with a mental health professional, as well as doing a personality assessment written test. And these two allow us to essentially identify any kind of mental disease or personality disorders. And again, make sure that the surrogate is well aware of what it would be like to have or to carry and have somebody else's baby. Another thing that we try to arrange for that in-office visit is to try to get the parents either to come in person or to be available on video. Spend a little bit more time with the surrogate, just to make sure that you're comfortable with her, that you feel like you can trust her, because after all, she'll be carrying your baby. So this is a sort of a half a day visit for the surrogates. And at the end of the day, if everyone is happy, in other words, you like her, she likes you, we don't find any issues, then we send you back to the agency to complete the legal agreement. And then by then, usually at that point, the embryos are already frozen, available, and ready. So we can immediately schedule the embryo transfer procedure. Just a few words about the embryo transfer. So what we do, I didn't list it here, but what we do in almost all cases, and that's regardless whose eggs and whose sperm we use, we essentially create the embryos, grow them for 5 or 6 days, and by doing that, we can identify those embryos that are growing well and are more viable. And then those that do develop and look good also undergo genetic screening, genetic testing. So that way we identify the best of the best. So that way we can pick one embryo and expect a very high success. And those embryos are created and grown, tested, and then frozen, and then waiting for the surrogate to become available. So once the evaluation is done, and once the legal agreement is done, and once the embryos are available, we focus all of our attention on the surrogate. And we start preparing her for the embryo transfer. And this may be a little bit technical, but I think it's really important to understand that there's different ways to prepare for transfer. And the idea, of course, is to, number one, probably make it successful, right? That's the most important. Make sure that not only the surrogate becomes pregnant, but also that the pregnancy has fewer issues, fewer complications. And what I list here is sort of the three main protocols or modalities that we use to prepare for transfer. So on one side, on one extreme, is what we call the natural cycle prep, which actually is trying to simulate the surrogate's own pregnancy. So most of them young, healthy, fertile, conceived naturally with no help. So essentially we try to copy that. And what that means is we try to identify her ovulation and time the transfer to her ovulation. So typically, if you think of what happens naturally, the embryo or the egg becomes fertilized and takes almost a week before it ends up in the uterus and ready to attach. So this is exactly what we do. We find out when ovulation occurs, and then we schedule the embryo transfer exactly 1 week later. The other extreme is what we call the medicated cycle, and this is where you actually create an artificial cycle for the surrogate using medication, hormones, mostly estrogen and progesterone. I'd say that this is, more of the standard in the industry, and historically, this is how it all started, right? The IVF started and preparing the uterus for implantation. However, when those protocols were established, it was actually before, egg donation and surrogacy was available, and it was more focused on infertile women. So here we have a completely different population. We have, like I said, young, healthy, fertile women. They don't really need all these hormones to get to be able to accept an embryo. So obviously, my preference is to use a natural cycle, and that's applicable, I'd say, almost in all cases. And then in between, there is sort of something that is sort of a hybrid, is where we, for women who don't have regular cycles and don't have normal ovulations, we can give them some medication, some fertility drugs to induce the ovulation, and then we time the transfer to ovulation. Again, same as with the natural cycle. So that's sort of a combination of the medicated and the natural cycle. Again, this is something that, I decide once I have all the information about the surrogate. And as I said, I prefer the natural cycle whenever possible, but of course, not everyone is the same. And I already covered this. What we find with, of course, the natural cycle prep is a logical approach to these young and healthy women. We definitely get better results as far as pregnancy rates, higher chance of becoming pregnant, and interestingly enough, fewer pregnancy complications. So things like bleeding in the early pregnancy loss, even preterm delivery and preeclampsia, hypertension in pregnancy, all these complications are reduced when you use a natural cycle preps. And of course, last but not least, as I said, we always try to make it easy for the surrogates. So the natural cycle is sort of a no-brainer because there's very little meds and no injection. So just to summarize, we always say sort of it takes a team to make this work. And, in this case, we work very closely with the agency on all the aspects of this process. So it goes back and forth. And, with working with the New York Surrogacy Center and Casey, allows us to be actually very comfortable that everything is done right on their side. And that way we can sort of focus on doing what we do. Yes, Casey.
Yeah, so I was just going to say that about the natural cycle, that we find that the surrogates really appreciate that. That's one of their favorite things, is that the lower, not having as many hormones, not having the injections, it just seems like a smoother process. They all report, feeling better on that protocol. So that's been a really great point about working with New England. And I echo your thoughts that it's a good partnership. It works really well for us as well. All of our patients have been very happy working with New England. If anyone wants to unmute and ask questions, we're more than happy to field questions about the agency process, the clinic side of things. Right. If there aren't any questions, one last call for questions, and then we'll wrap up for the evening. All right. Well, thank you everyone so much for joining us tonight. And please feel free to reach out to either us if you have any questions or would like to set up a consultation to discuss surrogacy options.
Great. And thank you for being with us, and good luck to you, wherever you end up. So good night.
Night.